I'm 35, and of course, in the course of my advocacy for the well-being of boys and men in Washington State, I'm becoming better informed about what's important to know about men's health specifically. But I was pretty ignorant until a few years ago when I started getting better educated. Now, when I think of men's health, prostate comes to top of mind, and I'm still quite ignorant about what a prostate is. And I was thinking, like, in contrasting sometimes when we look at high profile campaigns related to breast cancer and raising of funds related to that, and breast cancer awareness screenings and things like that we coach women to do. Breasts are something that I know where they are, I know what they do, and I know what they look like. But I can't say the same thing for a prostate. Like, I don't know what it looks like. I kind of know around where it is in my body, and I don't know what it does. And that's just like, that's not easy to change. I mean, breasts are just so much more, high profile than the secretive prostate thing. So I imagine that's not easy to overcome. When I think men's health and I think prostate, then I start to get lost. Like, oh, I can't picture it.
Yeah, because you can't see it. So it's one of those organs that a lot of people are unaware of what's its responsibility as far as function in your body. It gets pressed because of prostate cancer, which is a leading cause of death. It's one of the high-ranking causes of death behind lung cancer for men. And we didn't have a very good means of detection until the PSA test came out. That still wasn't great, but it was better than what we'd had, and we've refined it as far as our knowledge of how to use it.
Is prostate cancer something where if you wait until you're feeling physical pain from it, then you're in bad shape?
Most people who are curable don't know they have prostate cancer.
Wow.
That's a really good point. We do have a two-part episode on prostate cancer with Dr. Dan Lin, who's one of our urological oncologists at the University of Washington. It's a great episode. Everything in it is still current, and it goes through diagnosis and then through treatment. So if people are wondering about, well, what do I need to know about prostate cancer diagnosis, you can listen to the first half of the episode. If somebody knows somebody with prostate cancer and is wondering about treatment options, listen to the whole thing. Prostate sits actually as they say walnut sized, but it grows as we get older under the influence of male hormone testosterone. And it lies between the bladder and the pipe that drains your bladder, the urethra. It's in your pelvis. So the gland actually surrounds the urethra. So the pipe that drains urine from the bladder goes through the prostate, and that part of the urethra is called the prostatic urethra. So it's a conduit for urine. As it grows, it can cause obstruction, or what we call benign prostatic enlargement, otherwise called benign prostatic hypertrophy, BPH. It's a function of aging. And as guys age, they may know that their stream is getting a little slower. The consequences of the bladder as a muscle working harder to provide enough force to get urine through causes it to become muscular, which creates urinary urgency.
There is growth that can occur in a prostate that affects urinating that is not cancerous.
Absolutely. In fact, much more common than cancer. So there's all gradations of that to, yeah, stream isn't as strong as it used to be, but it doesn't bother me, to retention where it grows and you can't, the ability of the muscle to overcome the obstruction. So the ability of the detrusor muscle, the bladder muscle that's built in the wall of the bladder to squeeze hard enough, it just gives up. It's become ineffective and inefficient. And so you basically can't pee, and people end up in the emergency room because I tried to go and I couldn't.
Wow. Okay.
So that's BPH. There's infections of the prostate called prostatitis. It's commonly a bacterial infection. So the prostate is susceptible to infection, benign growth, and cancer. And its function in life, though, it contributes the fluid that supports sperm. So sperm come from the testes, right?
Yeah.
But what gets ejaculated is a combination of sperm and prostatic fluid. So it provides the right environment for the sperm to survive.
Wow.
So it's a important organ. Most guys are aware that, yeah, the prostate, where is it? And the reason that there's a digital rectal exam done through the rectum is that you can feel the posterior prostate. And patients correctly go, well, you're only feeling half of it. What, isn't there cancer on the other side? It turns out cancer is predominant on the posterior or side of the prostate that can be felt through the rectum.
Whoa. Okay.
So we get an idea about the size, contour, consistency of the prostate. We do a digital rectal exam, and that in combination with a PSA, we find very useful. People who have a very low and normal, consistently low PSA and a normal feeling prostate are at very low risk for prostate cancer. So, it's always good to go have a test and find out, hey, I just found out I'm doing okay, right?